So today I'm going to talk about non-accidental injury. So those kind of cases imply mostly children who has been abused by a mom or a partner. So it's very important not to miss those cases. So whenever you see, for instance, a child who has multiple bruise, multiple fracture, and the parent, they might say to you, for instance, the child has fall down, injured himself or herself. Sometimes they say stuff that doesn't make sense, and sometimes it's multiple occasion. So in that condition, you need to be vigilant, and you can say, for instance, I sense something else is going on. I'm really concerned about your child's safety. My primary goal is basically your child's safety. I'm sorry if I implied that you sounded that maybe there's some harm to your child, but my primary goal is basically to ensure that this child is in safe environment and are not victim of abuse. Say, for instance, you might come across a case whereby the mother, for instance, had a night shift, and when she came back home, the child with her partner, she might ask the partner, what was wrong with my child? So he might say, for instance, the child fall off at night. So in that condition, you have to be very vigilant, and you need to start questioning and try to ensure the child's safety. So basically, you need to check the child and look for his head and his bones. Also, you might send for serial X-rays, whereby you find multiple callus and the area of ribs, which would imply multiple fracture before or injuries. And in this condition, you need to raise the case with social service to help investigate the condition further, because your basic motive is safety, safety, safety. So we need to ensure with the mother first and try to not to be confronting, just basically ask her in a nice way without confronting that, do you feel safe at home? Do you feel that your partner is treating you well? Do you feel safe? Do you have a safety plan in place? Do you have a place whereby you can go to if you felt you're not safe? Do you have a number whereby you can call for help? Do you have the police number, for instance? And explain to her that it's not your fault, but you have to be more careful and addressing if there is something, for instance, going wrong. So that's in short for non-accidental injury. It's one of the important cases, and it shows as a Lab 2 station. Also, don't forget to introduce yourself and double check the patient name and the address and the date of birth. And if the child is being brought to the emergency or to the GP center surgery, and if the child was calm or was crying or in pain, all of that, you have to be looking for cues, not to miss any of that. So that's in brief for non-accidental injury. I hope I have covered the main important question that you need to ask, not to miss such an important case. Thank you.